Right, sorted.
Great. Would you like me to kick off, James?
Yes, please, if that's all right.
Excellent. Well, good morning, everyone. It's great to see you all. I'm really pleased to be introducing our Men's Health and Wellbeing Day. And thanks very much to David and James for facilitating today, and to all of the speakers attending. It looks like a really good programme, doesn't it, this morning? And I think just to say that this really does fit in with our drive as a trust on health and well-being of all of our staff during a really challenging time. Obviously, I'm sure all of you have had your own reflections and experience over the last couple of years. And now, as we're on the threshold of another huge push by the NHS on booster vaccines to try and get ahead of the Omicron variant of COVID, it's another big ask of all of our staff and all of our teams. And, you know, amongst all of our staff, we've got lots of different challenges and issues, and it's important that we're sensitive and we understand and we support each other. And in that context, having a Men's Health and Wellbeing Day, I think really does add and strengthen that. So the kind of issues that obviously affect men's health, we've got on the programme today a lot about fitness, about prostate cancer, about urological health, about mental health and well-being, mindful drinking. I mean, there are lots of specific areas where, you know, men need to think about and pay attention to. And it's good to have a space to kind of talk about that and to really, I guess, reflect and indeed challenge ourselves as men on what it is we need to be doing and what our contribution is. And of course, men's health has a knock-on impact across the whole of society in relation to the overall health and well-being of our communities. So there's a lot to think about, and there's a lot for us to consider. But I guess what I'd say first and foremost is just to be open and honest and to share in the Leeds way as we do, with a great level of collaboration, and also with a sense of focus on our patients as well, as we're thinking about their needs and requirements. So there's a lot in this, and I'm going to be really interested, I guess, to see what comes out of it. And hopefully it'll give us quite a few ideas and a really good platform on which to build for the future in terms of how we tailor our health and well-being offers to our colleagues, how we think about men's health in the context of our overall health and well-being offer for all of our staff. And also, hopefully, it'll inspire and support those of you joining, and maybe you'll take ideas away and connect with your colleagues and think about maybe changes and improvements to your own lifestyle approach to fitness and well-being. Mental health, I'm so glad to see that featured today, because the impact of the pandemic on mental health and well-being has been significant, as we know. And certainly if we're approaching some of the challenges that we had with this new variant, as if we're in danger of re-entering some of those periods of lengthy isolation, then that in turn creates challenges for people, doesn't it? Particularly the experience for a lot of people in terms of being isolated and missing that social contact. So that's a massive issue for people, and something I know that you'll be taking forward in today's session. So I really think I'll close there, James, David, but just to say a big thank you to you for organising this. It's great to see this on the agenda. It'll be good to see the kind of approach you come up with in terms of name, logo, mission statement, and how we take this forward. You can rely on me and the exec team and the trust for support on this as part of our wider health and well-being approach for all our staff, because everyone needs space to kind of take time to think, reflect, and consider what they can do themselves and how we can support one another. So thanks very much. I hope today's really, really helpful and useful. Do keep me informed with you know kind of where you get to and what comes out of it. And I'm sure there'll be plenty of positive steps we'll be taking forward as a result of today. So thank you very much, guys.
Thanks, Julian. Great intro. Thank you very much. Are you jumping off now, Julian? If you've got to go, I know you're busy. So
yeah, I've got to jump onto another call now, but I know you've got a video coming up from Stevie Ward, ex-Leeds Rhinos captain, which I'm going to just turn my camera off because I would like to see that. And of course, just to say, you know, with Leeds Rhinos, with Kev Sinfield's brilliant achievements in aid of the fantastic Rob Burrow Centre for Motor Neurone Disease that we're raising money for, obviously up at Seacroft. I think that's a great sort of contribution to today. So well done for getting that. Thanks a lot.
Thanks, Julian. Yeah. Right, I'll just stop recording for that bit.